Hi, my name is Shelby. I'm going to be your student physical therapist for the day. Can you confirm your name and date of birth, please?
Sure. My name is Patrick Connolly, and I was born September 21st, 1996.
Okay, so today I'm going to be performing some tests and observing you. Do I have your consent?
Sure.
What brings you in today?
I've been experiencing some pain.
Can you describe that pain for me, please?
Sure, it's a sharp pressure.
Okay, and where's that sharp pressure located?
Mostly in my neck, chest, and arm.
Okay.
Unstable angina is inadequate oxygen to meet myocardial needs. This can occur at rest, exertion, or stress. If not treated, it can lead to myocardial infarction or heart failure. Risk factors include high blood pressure, family history, sedentary lifestyle, and smoking.
First, I'm going to observe the patient for any signs of shortness of breath, cyanosis, pallor, or edema.
This patient may display symptoms of shortness of breath or cyanosis due to lack of oxygen.
Next, I will be observing the patient's hands. So will you put your hands out like this for me, please? Alright, so I'm looking for any signs of cyanosis or hemorrhages. If you flip your hands over, I'll be looking for tar staining or fat nodules.
This patient may display tar staining from smoking.
Next, I will be observing the patient's temperature. So will you put your hands straight out in front of you, please? Okay, I'm down with the back of my hands to see if the temperature is the same bilaterally.
This patient may appear sweaty or clammy.
Next, I will be seeing if the patient has any finger clubbing. So will you put your fingers just like this for me, please? Alright.
This patient could experience finger clubbing from pulmonary obstruction or disease secondary to their angina.
Next, I will be assessing the patient's capillary refill time. So if you put your pointer finger up like this, please. Alright. And then I'm going to hold 2, 3, 4, 5, and then watch the refill.
Normal capillary refill time is less than 2 seconds. If this patient has a blockage, capillary refill time could be lengthened.
Alright. Next, I will be assessing the radial pulse.
This patient may have a slower heart rate due to blockage. It is important to assess radial pulse bilaterally to determine if there is any discrepancies between the two sides.
Next, I will be assessing the carotid pulse. Alright, so I'm just going to feel around your neck. Okay. Next, I will assess the patient's jugular vein. So go ahead and take your head and turn it to the left for me. Alright, and now turn it to the right. Okay.
This patient should not display a distended jugular vein unless they have a secondary disease.
Next, I'm going to be taking your blood pressure. Have you had that taken before?
Yes.
Alright, so I'm going to put this cuff around your arm. Will you lift up, please? Thank you. I'm going to lift your shirt. Is that okay?
Yes.
Alright, lift your arm one more time for me. Thank you. Go ahead, put it down. Alrighty. Put this right here. Alright, rotate your arm for me just a little bit. Palm up. Thank you. Alrighty.
If this patient has a blockage, they will display high blood pressure. High blood pressure is also a risk factor for unstable angina, so they may display it without a blockage.
Next, I will be observing the patient's skin for any abnormalities or scars.
There should not be any abnormalities or scars seen with unstable angina.
Next, I'm going to be listening to your heart. There's 4 locations I'm going to be listening. There's 1 on the right and then 3 on the left. Is that okay?
Yes.
All right. So my stethoscope may be a little cold, and I apologize. All right, so the first one I'm going to feel for your second intercostal space.
For the aortic valve,
All right, and then I'm going to do the same thing on the left.
for the pulmonary valve,
Okay, and I'm going to look for your fifth.
for the tricuspid valve,
All right, and then I'm going to go over here.
to the midclavicular for the mitral valve. Heart sounds for this patient should be normal.
Here I will be assessing the patient for edema.
This patient should not show signs of edema.